1. Congressman Vicente Gonzalez PBM Reform Act 2025, Impact on South Texas Patients and Pharmacies. 2. PBM Reform, How Congress and States are Changing Prescription Drug Pricing. 1. Congressman Vicente Gonzalez PBM Reform Act 2025, Impact on South Texas Patients and Pharmacies. Unveiling the battle against rising drug costs, a South Texas story. In a bold move to protect patients and pharmacies, Congressman Vicente Gonzalez has introduced the PBM Reform Act, a bipartisan initiative that aims to tackle the rising drug costs and harmful practices in the pharmacy sector. But here's where it gets controversial. The Act, H.R. 4317, seeks to regulate pharmacy benefit managers, PBMs, who, according to Gonzalez, are lining their pockets at the expense of life-saving drugs. Pharmacy benefit managers drive up costs, and it's time we put a stop to it, he asserts. Co-sponsor Congressman Buddy Carter agrees, emphasizing the need for transparency and competition to address the issues caused by PBMs. This initiative has gained support from a diverse group of co-sponsors, reflecting a united front against the dominance of just 3 companies controlling 80% of the prescription drug market. This concentration of power has led to higher costs and pharmacy closures across the nation, impacting communities like South Texas. And this is the part most people miss. The PBM Reform Act aims to ban spread pricing in Medicaid, ensure fair reimbursement for pharmacies, and increase price transparency for patients and employers. It also calls for stricter oversight from Medicare, a crucial step towards protecting patients and ensuring access to affordable medications. Gonzalez's efforts extend beyond this act. He has proposed several other bills, including H.R. 4449, which aims to establish offices for small businesses within the Securities and Exchange Commission, and H.R. 1791, focused on increasing credit union lending for business growth. These proposals showcase his commitment to supporting businesses and communities. In terms of fundraising, Gonzalez recently disclosed $464.6 thousand, with a significant portion coming from individual donors. His spending and cash on hand reflect a well-managed campaign, as seen in the detailed FEC disclosure. So, what do you think? Is the PBM Reform Act a step in the right direction to tackle rising drug costs? Or are there other factors at play that we should consider? Feel free to share your thoughts and opinions in the comments below. 2. PBM Reform, How Congress and States are Changing Prescription Drug Pricing. Pharmacy benefit managers, PBMs, are under intense scrutiny, facing pressure from both state and federal lawmakers. Providers and pharmacies argue that these pharmaceutical intermediaries are compromising patient care, while insurers and employers rely on PBMs to reduce the costs of drug benefits. But here's where it gets controversial. Some believe that PBMs are doing more harm than good, while others see them as essential players in the healthcare ecosystem. On July 1, Illinois Governor J.B. Pritzker signed the Prescription Drug Affordability Act, placing significant restrictions on PBMs. These entities typically negotiate lower drug prices on behalf of health insurance plans and create formularies that often favor less expensive medications. The new Illinois law, inspired by similar measures in other states, prohibits PBMs from steering patients to pharmacies where they or their health plan owners have financial stakes. This move aims to prevent conflicts of interest and ensure fairer treatment for patients. A recent analysis by the American Medical Association, AMA, reveals that the top 3 PBMs, CVS Caremark, OptumRx, and Express Scripts, control a substantial portion of the market and are vertically integrated with major health insurers. This consolidation raises concerns about the potential for conflicts of interest and reduced competition. The Illinois law also tackles the issue of spread pricing, a practice where PBMs charge health plans more for prescription drugs than they negotiate with pharmacies. By eliminating this practice, the law aims to reduce overall healthcare costs and ensure that pharmacies are fairly compensated. To support smaller, independent pharmacies, the Illinois law includes a provision that taxes PBMs to fund an annual $25 million program. Starting in 2026, PBMs will be required to pay a $15 annual fee per person covered, which will go toward financial assistance for these local businesses. And this is the part most people miss, the law recognizes the importance of independent pharmacies in providing personalized care and ensuring access to medications in underserved areas. Not surprisingly, the Pharmaceutical Care Management Association, PCMA, which represents PBMs, has criticized the new law. They argue that it will hinder employers' ability to offer affordable health benefits and increase healthcare costs for everyone. The PCMA claims that the legislation imposes unnecessary taxes and restricts the flexibility of employers in managing their health plans. On the national stage, Congress is considering similar legislation. Last week, U.S. Representatives Raja Krishnamurti, Democrat Illinois, and Earl Buddy Carter, Republican Georgia, along with 9 other representatives, introduced the bipartisan PBM Reform Act. This act focuses on Medicare and Medicaid and aims to ban spread pricing in Medicaid, ensuring fair reimbursement for pharmacies. It also proposes to decouple PBM compensation from drug costs and increase transparency through regular reporting on drug spending, rebates, and formulary decisions. Krishnamurti highlighted the findings of a recent Federal Trade Commission (FTC) report, which revealed that PBMs often prioritize their own pharmacies over independent ones and significantly mark up the prices of specialty generic drugs, such as those used to treat HIV, cancer, and other serious conditions. But here's where it gets even more interesting. The PCMA counters that the real issue lies with Big Pharma, which sets the prices of prescription drugs. They argue that focusing solely on PBMs will not solve the problem of high drug costs and suggest that lawmakers should address the entire prescription drug supply chain. Employers, who depend on PBMs to manage the rising costs of prescription drug benefits, are increasingly scrutinizing their contracts. According to a survey by health benefits broker Gallagher, 32% of employers are now looking to revise their PBM contracts or seek new partners to optimize their drug spending. So, what do you think? Should the focus be on PBMs, Big Pharma, or both? Share your thoughts in the comments.